47% of people who have a heart attack in the next 12 months have already experienced a warning sign they dismissed. Not half, not about half, 47%. And the majority of them told someone about it or noticed it themselves and did nothing. Most never connected it to their heart at all. If you are over 60 and you have ever felt an ache, heaviness, numbness, or tingling anywhere in your left arm, even once, even briefly, this is the video you did not know you needed. Here is what we are going to go through today: the 7 warning patterns of left arm pain that carry cardiovascular significance after 60, exactly what is happening in your body when each one occurs, the early signs most people miss in themselves and in the people they live with, and what you can realistically do right now. Not next week, not after your next checkup, right now. All 7, all of it. If clinical precision and no nonsense health education is what you are here for, hit subscribe. We are building toward 200,000 people who take their health seriously, and you being here suggests you are one of them. Now, left arm pain. And I want to address something directly. Most people think this is simple. Left arm pain means heart attack, call an ambulance. Done. That framing is so incomplete, it is actually dangerous because it causes people to ignore anything that does not feel dramatic, and it causes panic over things that are not cardiac at all. The truth is more layered, and understanding the layers could save your life or the life of someone you love. The first pattern is the one most people think they know, and most people get wrong. The myth is that cardiac left arm pain always feels sharp, sudden, and unmistakable. It does not. The clinical picture of myocardial ischemia, that is, reduced blood flow to the heart muscle, is far more often described as a dull ache, a heaviness, or a pressure that radiates down the inner left arm toward the fourth and fifth fingers. It can begin mildly, it can come and go. The 2021 data from the British Heart Foundation found that 30% of heart attack patients initially rated their pain as less than 5 out of 10, nearly 1 in 3. The mechanism here is referred pain. Your brain receives pain signals from the heart via shared nerve pathways, and it misroutes the signal to the arm, the jaw, or the back. Think of it as crossed wires on an old telephone exchange. The call is coming from the heart, but it rings in the arm. Angina pectoris. Episodes of chest pain or discomfort caused by reduced blood flow often presents this way for years before a cardiac event. If you are over 60 and you notice left arm discomfort during exertion, walking upstairs, carrying shopping, or after a heavy meal, that pattern deserves investigation. Do not wait for it to hurt more. The action is simple. Note when it happens, what preceded it, and how long it lasted. 3 episodes with that pattern warrant a call to your GP today, not at your next routine appointment. This one surprises people. Left arm pain that begins in the neck or shoulder and is worse when you turn your head or look upward is more likely cervical radiculopathy, compression or irritation of a nerve root in the cervical spine, typically C6 or C7, than a cardiac cause. After 60, degenerative disc disease is extremely common. A 2019 review in the Journal of Orthopedic Surgery found that radiographic evidence of cervical degeneration is present in over 90% of people over 65. 90%. The nerve root compressed by a narrowed foramen, the opening where it exits the spine, sends a pain signal that travels the full length of the arm and often includes tingling or weakness in specific fingers. The critical distinction: cervical pain is positional, it changes when you move your neck. Cardiac pain does not. It is provoked by exertion and relieved by rest. That distinction is your first filter. If your arm pain is worse when you tilt your head to one side, a physiotherapy assessment and cervical imaging is the appropriate next step, not a cardiology referral. The harder changes to catch are the invisible ones. Thoracic outlet syndrome, compression of the nerves and blood vessels running between the collarbone and the first rib, affects a significant minority of adults over 60, particularly those who have spent decades in desk based work or driving. The subclavian artery and brachial plexus pass through a narrow corridor, and over time, postural changes, muscle tightening, and mild structural shifts narrow that corridor further. The result: left arm heaviness, fatigue with use, and in some cases, a subtle difference in skin temperature between the two arms. You can check this at home right now. Hold both arms above your head for 60 seconds. If one arm blanches, turns pale, or begins aching significantly faster than the other, that asymmetry is worth reporting. It is not an emergency, but it is not nothing. The named clinical tool for formal assessment is the Adson's test, performed by a physician, combined with a duplex ultrasound of the subclavian vessels if indicated. Treatment ranges from targeted physiotherapy to, in a small number of cases, surgical decompression. The fourth pattern is one that primarily affects women over 60 and is systematically underdiagnosed. Variant angina, also called Prinzmetal's or vasospastic angina, occurs when a coronary artery goes into spasm rather than being blocked by a fixed narrowing. The mechanism is different from classic angina, and critically, it can occur at rest, often in the early morning hours. A 2020 paper in the European Heart Journal found that vasospastic angina is nearly twice as common in women and is frequently misattributed to anxiety or musculoskeletal pain. Twice as common. The downstream consequence of missed vasospastic angina is significant. It can trigger a dangerous arrhythmia during the spasm itself. If you experience episodes of left arm discomfort or chest tightness that wake you at night or occur at rest, tell your doctor specifically and ask about a calcium channel blocker trial, which is the first line pharmacological approach for this condition. Do not accept anxiety as a diagnosis if this pattern fits. Push for an ECG during symptoms. Now, the role of peripheral arterial disease, PAD, in left arm pain after 60 is underappreciated. PAD is the narrowing of arteries supplying the limbs due to atherosclerosis, the same plaque buildup that affects coronary arteries. When it affects the subclavian or brachial artery in the arm, the result is arm claudication, pain or heaviness in the arm with use that resolves with rest. The ABI, the ankle brachial index, is the standard screening tool, but an interarm blood pressure difference of more than 10 to 15 millimeters mercury is a red flag that warrants vascular assessment. You can check your own blood pressure in both arms with a home monitor. If the readings differ by more than 10 points on the systolic number, the top number, consistently, mention it to your doctor. That asymmetry can be the first visible sign of subclavian artery stenosis. The sixth pattern involves the shoulder itself. Rotator cuff pathology, tears or tendinopathy affecting the four muscles and tendons that stabilize the shoulder joint, is the most common cause of shoulder and arm pain in adults over 60. A systematic review published in 2020 found that rotator cuff tears are present in 50% of people over 70, most of whom have no significant symptoms. 50%. The arm pain here is typically provoked by specific movements: reaching overhead, sleeping on the affected side, or lifting, and the shoulder itself is tender to palpation. The key clinical test you can do right now: the empty can test. Raise your arm out to the side at shoulder height. Then tilt your thumb downward as if emptying a tin. If this movement is painful or weak compared to the other arm, a physiotherapy assessment or musculoskeletal ultrasound is appropriate. Rotator cuff pain can be significantly reduced with targeted rotator cuff strengthening. 3 to 4 sets of external rotation exercises 3 times per week. And in resistant cases, a corticosteroid injection to the bursa provides effective short term relief. The seventh pattern is the one that is most often dismissed in over 60s and most consequential when it is. A transient ischemic attack, a TIA, what most people call a mini stroke, can present with left arm weakness, numbness, or heaviness, lasting minutes to hours before resolving completely. The FAST acronym, face drooping, arm weakness, speech difficulty, time to call, is well known. But the isolated arm symptom is frequently ignored when the other features are absent. A 2018 Lancet study found that 10% of people who have a stroke had a TIA in the 7 days preceding it. 10%, and most of them waited. The 5-day stroke risk following a TIA is highest in those who delay assessment. If you or someone you love experiences sudden weakness or numbness in one arm, especially with any speech difficulty, confusion, or vision change, however brief, treat it as an emergency. That is not alarmism, that is the clinical standard of care. Get to an emergency department or call emergency services. The window for intervention is narrow, and timing determines outcome. Let me tell you about a patient, call her Margaret, 67, a retired teacher. She presented to a cardiology clinic after 6 weeks of intermittent left arm heaviness. She had attributed it to carrying her grandchildren and to a new gardening routine. Her background included well controlled hypertension, a family history of heart disease on her father's side, and a 15-year history of smoking she had quit at 52. Her ECG at rest was normal, but a stress echocardiogram, a cardiac ultrasound performed during exercise, revealed regional wall motion abnormality consistent with ischemia. A coronary angiogram confirmed a 70% stenosis of the left anterior descending artery. She underwent percutaneous coronary intervention, a stent, the following week. 6 months later, she reports no arm symptoms and normal exercise tolerance. The lesson is not that all left arm pain is cardiac, it is not. The lesson is that the absence of drama does not mean the absence of danger, and that acting on a pattern, rather than a single alarming episode, is what changed her outcome. Before the action summary, I want you to look for these early markers in yourself and in the people who live with you. Cognitively, new difficulty concentrating, increased fatigue with tasks that previously felt easy, or uncharacteristic forgetfulness. Behaviorally, avoiding activities that previously caused mild discomfort, sleeping differently, or unconsciously guarding one arm.
Physically, a cold or pale left hand, swelling around the shoulder, or an arm that fatigues rapidly with normal tasks like blow drying hair or stirring a pot. Right now, do this. Check your grip strength by squeezing both hands around a rolled towel simultaneously. A meaningful asymmetry, one side noticeably weaker, is worth noting. For formal objective measurement, ask your GP about the Edinburgh Claudication Questionnaire, a validated tool for assessing vascular related limb symptoms available through the British Heart Foundation website. Here is your action summary. Note every episode of left arm discomfort, time, duration, what preceded it. Check your blood pressure in both arms and report a difference greater than 10 points. Do the overhead arm elevation test at home today. Perform the empty can test for rotator cuff function. If the pattern is exertional, cardiac, and you are over 60, request a stress ECG, not just a resting one.
If onset is sudden, call emergency services. Do not wait for the pain to return, worsen, or become worth bothering someone about. It already is. If any of this has applied to you or to someone close to you, hit the like button. It tells the algorithm that content like this matters, and it helps us reach the people who need it. We are working toward 200,000 subscribers, and every share moves that number. Share this with someone in your life who would benefit from any of this. Not because it is a good video, but because the information in it could genuinely change what they do next time they feel something in their left arm. And I want to ask you one question. How old were you when you first noticed something in your left arm and brushed it off? Leave it in the comments. I genuinely want to know. Because that number tells us something important about when education like this needs to reach people. Everything here is for educational purposes only. Your health picture is yours alone.